Okay. Well, hi everyone. I'm Ashlyn. I'm on the marketing team with Digital Medicine. This is Carly. Today we are going to present a webinar on longevity. It's going to be super fun. If you do miss anything, it will be recorded and sent out to you in an email. And if you have any questions, just ask them in the Q&A or chat box and we can stop and answer them. But other than that, Carly, feel free to take it away.
Yeah, thank you for having me, Ashlyn. This is such a great opportunity, especially for clinicians and health coaches in the digital medicine program, to provide some insight and knowledge to all of you, and then also discuss the program as a whole. So thank you so much for taking a snidbit of your lunch hour with me today. And like Ashlyn mentioned, if you have any questions throughout, put them in the chat. She will be filtering through those. I just a little bit of background about myself. I received a Bachelor of Science in Nutrition from the University of Arizona, go Cats, with chemistry as my focus, and then went on to get my doctorate of pharmacy from the University of Colorado. Did a PGY1 general residency at the University of Colorado, followed by a specialty year of residency, specifically in ambulatory care, so chronic disease state management. And I've been with the digital medicine program for nearly 4 years now. So I don't know how that time's gone by, but here we are. So I'm very happy to be with you. And I was just in a meeting and they did an icebreaker question, and I thought it was a great one. So if you could all put in the chat. So the question is, if you were your own weather forecast, what would you be today? So would you be sunny? Would you be partly cloudy? Would you be in a tsunami because or your work day is just crazy? Put in the chat what your weather would be. Don't be shy. Is the chat working?
I'm looking.
Oh, it's in the Q&A. Just do it in the Q&A. Just
Yeah, so
type your answer there.
yeah, with such a large group, it's going to be Q&A, and then I could see. So we have
Sunny.
one. Someone said sunny, sunny, cloudy, partly cloudy.
Yay, we have a lot of sunnies.
I
This is
like this one,
great.
sunny and breezy. I think I would be sunny and breezy, just like, you know,
Calm, cool, and collected. Love that.
yeah.
I was feeling this morning, I was feeling cozy. I had a candle in my coffee, so I was feeling like a little snow drizzle.
I love
But
that.
hopefully, yeah, hopefully by the end of this presentation, you all will be, if you're not already super sunny and bright, hopefully your day is going to be a little bit of brighter and you'll be able to leave here with some information and knowledge.
Awesome.
All right, so let me go to the next slide here. All right, so at the conclusion of this presentation, I'd like for you to be able to do the following. So explain lifestyle modifications that can help optimize a healthier life, apply interventions that you can use at home to reduce fall risks for you and your loved ones, identify preventative healthcare measures you can implement in your life to increase longevity, and then also be able to describe what the Ochsner Health Digital Medicine Program is. So let's do a little bit of brief background into the aging population in the United States. So when I was creating this presentation, I thought this illustration to the right was very impactful because currently the population's older than it's ever been. And between 2022 to 2060, it's projected that people over the age of 65 years old are going to grow by 48%, which is astounding. And we're expected to see a shift in the population, and especially by 2060, we're going to see the population of adults over the age of 65 far exceed the population of children under the age of 18. So as you can see here, and let me get my little, can you see my pointer? Oh, wait, here we go, laser pointer. As we can see here, so children under the age of 18 is illustrated here in the burnt orange color. In 2016 was 22.8% of the population, or 73.6 million people. And then adults over the age of 65, so this blue color composed 15.2% of the patients or population, or 49.2 million. And as we see on this x-axis, the time that goes by, in 2034, we're expected to see at this point where adults over the age of 65 are just going to start surpassing / meeting the population, or be equal to children under the age of 18. And then, as we can see, by 2060, which is right here, we'll see that the population over the age of 65 is going to compose 23.4% of the population, so nearly a fourth. And children under the age of 18 is going to be far below it at 19.8. So I thought that illustration was very astounding. And the next slide is also going to help illustrate the aging population. So here's another graph on the right, and this is really focusing on by 2060, so this portion on the right, that 1/4 of Americans will be 65 years and older. So as we can see, 65 is like right here. So if we split it up, all these patients are going to be over the age of 65, females on right in burnt orange, males on the left in that blue aqua color. And then also another thing that I want to point out is, as you can see here in 1960, this small percentage of people that were over the age of 85. So you can see all the ages on this x-axis. By 2060, this is going to triple, quadruple in size. So patients and people are living a lot longer, which is, has its pros and cons. So there's a few positives listed here. It's important to note that obviously, as we get older, we're living longer. The education levels is also increasing in this population over the age of 65. So in 1965, only 5% of people had completed a 4-year degree, only 5%. And in 2023, this has risen up to 1/3 of the population. So now up to 33% of the population, 65 years and older, has a 4-year degree. So we're getting smarter. Also, this could be a positive or a negative, depending on how you look at it, but older adults are working longer. So in 2022, 24% of men and 15% of women over the age of 65 were in the labor force. And it's expected that in 2032, this is going to increase to 25% of males and 17% of females still working over the age of 65. Again, positive or negative, depending on how you look at it. And then another positive, as time goes on, more adults can meet their daily needs. And this is, obviously because of new inventions that we didn't have in the 1960s. But things like, canes, walkers, wheelchairs, all of those things. And then things like the digital medicine program, where they can monitor their blood pressure at home. They can monitor their diabetes at home. There's no transportation issues. So we can really help these patients live a healthier life. So challenges. I know we're talking, and seeing these statistics that as time goes by, we're living longer. But there was actually a decline between 2019 and 2021, a 2.4 year decline on life expectancy. And that had a lot to do with unforeseen circumstances, such as the COVID-19 pandemic, an increase in suicide rate, and an increase in heart disease. But as of 2022, we did see a slight uptick in lifespan, and it was averaging at in 2022 that the average life expectancy was 77.5 years. Another challenge to the increase in population is there is an alarming rate of obesity that's increasing, making it challenging to take care of these patients to some degree. And There's also a caregiving gap. And this is specifically looking at our Alzheimer's patients. Right now, there's about 6 million patients living with Alzheimer's disease, and that's expected to increase over double by 2050 to 13 million. So we're seeing that caregiving gap, which can be concerning. And sorry, there's a lag in there we go. During this presentation, we're going to be harping on the following 3 points really to keep healthy. So one, we're going to be going over some lifestyle modifications, again, the reducing the fall risk and things that we can do preventatively and proactively to make sure that we live a longer and healthier life. So first off is lifestyle modification. So as we just noted, we can't use the comment function. So if you could use the Q&A function, because it's such a large crowd here with us today, what are different lifestyle modifications that you think we can do to live a longer and healthier life? Eating healthier, moving more, exercise. Yeah, so using digital medicine. Hey,
Amazing.
Jessica.
Stay hydrated. That's a big one.
Yes, hydration is key. So
Yes.
let's discuss this more in detail. What I really wanted to focus on was weight management. It really encompasses all of those things that you guys just mentioned. So the diet, the exercise. What I really think is important is, really getting a hold on that weight to help live a longer, healthier life. And so the reasoning for this is obesity is a major, major risk factor for developing all of the following weight related complications. And this isn't an all-encompassing list, but it's things that we can definitely, improve on. So obesity and being overweight is a risk factor for both prediabetes as well as type 2 diabetes. And that's really because that excess body fat is particularly around that abdominal area can lead to insulin resistance. And then the body's cells no longer function properly. And this causes an elevation in those blood sugar levels. The next thing is cardiovascular disease. So cardiovascular disease, including heart attacks and then strokes too. You're also at an increased risk for these events with excessive weight, and it contributes to that elevated blood pressure, high cholesterol, and in turn, hardening of those arteries, causing these events to occur. So it's really important that we're being proactive to reduce the risk of this. And then excessive body weight, particularly around the neck area, can increase our risk for sleep apnea. This will in turn cause daytime fatigue, reduce the amount of work we're getting done, or our productivity will decrease, high blood pressure, and then in turn will lead to an increase in heart disease. And then next, the joint problems. So the increase in weight definitely has an effect on our joints, specifically those weight-bearing joints. So when I think of weight-bearing, the knees, the hips, the lower back are really going to be affected, causing increase in stiffness and a decrease in the mobility. And it can lead to, an increase in fall risk, especially if you're getting, osteopenia, osteoarthritis. And then respiratory issues, increase in shortness of breath, increase in asthma. And then at the forefront of all chronic disease state management, it's really important as a healthcare professional to really hone in on the psychological impact as well as the social impact, and really want to make sure that we're improving mental health and quality of life. And, it's really important to note too with weight management that this is a patient-centered approach, and we have to make sure to individualize this approach based off of personal cultural preferences. As at the end of the day, a lot of things can lead to weight gain, not only genetics and food, but also medicines such as, insulin, steroids. These all can increase our weight. So really having to make it a personalized approach. Next is diet. Again, really needing to make this a personal approach and culture, going based off cultural preferences. But at the forefront, always make sure that we're addressing mindful eating. So really taking out those extra, snack breaks if they're not needed. Portion sizes are really going to, again, be at the forefront of this care. And it's key to limit these unhealthy foods. So the processed foods, the sugary snacks, and the excess salt. When I'm discussing these things with my patients, I really encourage them to bring it back to the grocery shopping. Okay. So I say, when you're grocery shopping and you're going, get your shopping cart, really focus on the perimeter of the grocery store when you're picking out your foods. So you start off with, the fruits, the vegetables. When you're in the bread section, focus on those whole grains, 100% whole wheat. When you go into, the back where the refrigerator is, looking at low fat, skim milk, Greek yogurt, things like that with reduced fat. And then get to the meat section, focusing on those lean meats such as chicken, fish. And then, if you're someone that, you can't finish all of the fruits and vegetables, you might want to consider frozen fruits and vegetables versus ones that are within the aisles, that have that increase in sodium. Is I always say anything within the aisles is going to get you in trouble. And then at the end, before you check out, really looking in your cart and being like, asking yourself, is there a healthier alternative for any of the things in this cart that I can substitute? And going from there. But it all starts shopping. And these days they have apps online for a lot of grocery stores. So ordering your groceries through the app, pulling up and, having them loaded into your car is it saves you a lot of money, I have found out. So the meal plans, the Mediterranean, that's what we recommend for our patients with high cholesterol. So focusing in on those diets that are rich in lean meats. So the white meat, fish, nuts, olive oil, the fruits, vegetables, whole grains, and reducing those, processed fried foods. The DASH diet, that's typically what's recommended to patients with hypertension or high blood pressure. And it has a recommendation of less than 2,300 milligrams of sodium per day. There's also a refined DASH diet for some patients that has a recommendation of less than 1,500 milligrams of sodium per day. But again, everything needs to be patient specific. There's low fat, high protein, vegetarian, the list goes on and on really for the different types of meal plans. And then also something to consider are the meal replacements if you're having a challenging time cooking meals. Hydration, somebody said hydration. So for the average person, 8 ounce cups of water per day. Again, you have to individualize it. That requirement may not be recommended for everybody, especially, some of those patients with heart failure that may need less. And you want to be able to seek support. So a dietitian or a professional health coach if you're running into, any problems or questions. Okay, now switching gear to from diet to physical activity. So regular exercise, again, an individual approach. Something that's recommended for me is not going to be recommended for Ashlyn, maybe. So it's really important to include a variety of exercises that fit your needs. It's recommended over 150 minutes per week on 3 to 5 separate days. So I consider that 30 minutes most days of the week. Okay. And when I think of aerobic physical activity, I'm really thinking of things such as walking, running, cycling, getting that heart rate elevated. And moderate activity too is something that quote unquote breaks a sweat. Okay, so you want to be moving, you want to get that heart rate elevator in. The second thing is resistance exercise. So this is when you're really focusing on a major muscle group. So for example, I have it set into three different categories. So one day I might do abs and legs. Another day I might do like back and triceps. Another day biceps. So really focusing on what you need, and we want to decrease that sedentary behavior as much as possible. You can also seek support. So, exercise trainer, if you have disabilities or if you just got a hip replacement, etc., seeking support from a specialist that can really provide you with that resource. So, physical occupational therapists are great resources.
We have a question.
Yeah.
Someone asked if there's a formula recommended for daily water intake based on body weight.
That's a good question. I have not heard of that. I have just heard about the specific 8 ounce glasses a day. So 64 ounces recommended of water intake. But that's a good question. I'll have to see if there's a specific recommendation, if there's an increase based off of an increased body weight. But to my knowledge, I'm not aware of that. Is anybody else? If you are aware of that, feel free to put that in the Q&A as well. All right, so let me get to the next slide here. Oops. All right, so everyday behaviors. So it's really important to aim for 7 to 8 hours of quality of sleep per night. As lack of sleep, it can really affect those hunger hormones and lead to weight gain. Managing stress, so finding healthy ways to cope with stress, such as exercise, which we just mentioned, meditation, hobbies, staying connected with friends is really going to help that social interaction. Um, and a lot of times it's going to help, combat that feeling of isolation and loneliness as well. And then, social interaction is essential for that mental and emotional well-being. And finally, we want to have our brain and our mental health stay stimulated. So keep your mind active by reading, doing puzzles, learning new skills, finding hobbies that you really enjoy that's really going to make your life fruitful. All right. So now switching gears to how we can reduce fall risk. So what are recommendations that you guys typically give for patients if you're patient facing a role, or what you recommend for your parents that are getting older, grandparents, etc. How can we reduce their fall risk? Oh, and then we also got some stuff for the hydration. So usually say half your body weight in water a day. I was told half your body weight. Someone who weighs 130 pounds would need 65 ounces. Okay, so nutritionist told me for water, 100 pounds. So very patient specific again. Okay, so how to reduce fall risk? Yes, removing rugs. Maintaining foot speed with age helps. Yes, that's a good one. All right, awesome. So let's get into how we want to Reduce, yep, no slip soles, declutter, declutter, declutter. That's right. I currently don't have a problem. We just moved into a new house. I might be echoing a little bit. So there is no clutter anywhere. I'm currently in an empty room as we're awaiting our furniture to arrive. All right, so fall overviews. Falls are a leading cause of injury in older Americans, and actually those over the age of 65, 1 in 4 each year are expected to have a fall-related injury. And once you fall, you're at an increased risk for another fall. So it's really crucial to prevent that first fall proactively. So don't remove the rugs once the fall has happened. Remove the rugs now so a fall does not occur. That's one of the things we're considering right now is, do we put hallway rugs in our long hallway we have? And I'm like, no, in case Nana comes over, we don't want her to fall over the rugs going to the boys' room. Whoa, go back. And then falls can lead to 1, permanent disability, 2, high medical costs, and 3, premature death. When I was in residency, I was working with the endocrinology unit, and one of the endocrinologists gave me a staggering statistic. So they said that when an older adult falls from standing height and fractures either a hip or spine, 25% of those patients will go back to their normal daily life and daily living activities. 25% after that are going to have to use assistance from something like a cane or a walker or a wheelchair. Another 25% is going to end up in an assisted living or some sort of care facility to assist them. And then the final 25% will have premature death related to the injury. So after that statistic, I really encourage everybody to go over these fall risks. Whitney, fall at any age could lead to death. That's exactly right. So yeah, so that statistic was just over the age of 65, but you're completely right. So it's really important for all of us, especially those at higher risk, which are on this slide above, to be really cautious. So health conditions can increase our risk. I listed, a few right here. So again, diabetes. Patients with diabetes, if their sugars are uncontrolled for a long time, this can lead to something called neuropathy. So it's that tingling in the hands and feet, because our nerves are kind of closed. I think of it as closing at the end, and blood supply can't get there. So we get this tingling sensation. Also with diabetes, because of that, we really focus on one of our counseling points is doing daily, or weekly foot monitoring. So making sure you have no wounds, because the blood supply can't get there to help heal it. And that's why you hear of amputations. So being specifically cautious, in patients with neuropathy. Heart disease, that's another biggie. Arthritis, neurological problems, deafness. If you can't hear, you might trip over the dog, trip over the cat. You don't know. Blindness, cataracts, glaucoma. When there's trouble seeing, you're not going to see that stare or that half-inch step up. So really making sure that we're being proactive to reduce all of those barriers. And then dementia as well, not knowing you're in a bed and then get up, unexpectedly and fall. And then certain medicines too, as I'll discuss in a moment, can increase our risk. So it's really important that we're educated on the medicines that we're administering for ourselves and our loved ones. So let's reduce the risk. Again, we've talked about the loose rugs, get rid of them. Mats, we don't need them. Stairs, make sure they're safe. Make sure they have, the grippy on the stairs to prevent, grandma when she goes down in socks, even though you've told her a million times not to, that she doesn't, slip and fall. Adequate lighting. There's actually, I was my my aunt just told me there's little lights on Amazon, they're battery operated that you can buy, and you can stick, down the stairs that will light the stairs. So I thought that was a great solution to that as well. We want to make sure that there's on both sides, not just one, the railings. So the house I just moved into does not have on both sides, so that's on my to-do list. And then again, the lighting. Someone mentioned comfortable footwear. That's exactly right. For a lot of patients, we want to make sure it's closed-toed shoes. I don't want, grandpa's, Velcro flip-flop to get stuck in between the carpet and fall over. And incorporating that physical activity, like we previously discussed, is going to help with all of these things. Again, physical activity is going to help reduce that fall risk. So mixture of all types. Balance we didn't touch on previously, but balance is such a huge one. And if you are, able, Pilates is a great source of balance, and you can go on YouTube and just YouTube, different Pilates exercises, and that is a great, um, a great solution to balance exercises. Go on a walk in a park or a mall. I think, oftentimes I hear, oh, it's too hot out. I'll get more fit in the winter, and then winter comes. Oh, it's too cold out. Well, a mall is a great solution. When I was pregnant, I was living in Arizona, and it was the middle of the summer. So a mall was key, and it had bathrooms at every corner, which was even more ideal for me. Online fitness programs, again, you don't need to pay for exercise routines. Simply go, on the internet, um, read them over, do them wherever. And then if you need extra assistance or need to modify it to make it more personal to you, personal trainer to increase that muscle mass. All right, so now we're going to be discussing some preventative healthcare measures. What preventative healthcare measures do you guys think would help to optimize your life, to increase, put put extra years on that life of yours? You can put it in the Q&A. Things that we haven't discussed thus far. Smoking, drinking, those are really good ones. And I did not mention those in these slides, but those are key. Those are really, really good ones. Mammo, colonoscopy, bone density checks, yes. Yes, all those guideline recommendations, all of those are to be proactive instead of reactive. All right. So first I wanted to mention, the pharmacist that I am really wanted to go over the medication aspect of being proactive first. So the American Geriatric Society, they create a list of medicines that are a potential increased risk for patients over the age of 65. And these medicines, patients can be prescribed them over the age of 65 because sometimes, the benefit of these medicines, what they're doing will outweigh the risk. But sometimes the potential harm outweighs the expected benefit. And so I wanted to touch on these. So they're organized, the American Geriatric Society, the Beers criteria, they're organized into 5 different categories. And so first, medications considered as potentially inappropriate, medicines potentially inappropriate in patients with certain disease states or syndromes. The third one is medications to be used with caution. Fourth, potentially inappropriate drug-drug interactions. And then the fifth one is medications whose dosages should be adjusted based off of kidney function. So if somebody's kidney function is decreasing, it's really important that we're looking at their medicines to make sure that they're dosed appropriate and they don't build up in a patient's system. And then I'm going to go over just a few examples here of potentially inappropriate medicines. So the following are just 3 different classes of medicines. There's a whole bunch, but these are the ones that I thought, maybe more common than others. So these different classes, they are potentially inappropriate medicines in patients over the age of 65. So benzodiazepines, you may have heard of them more commonly. Their brand names, Valium's one, Xanax is another one. And these 2 medicines, or this class of medicines, are used for things such as anxiety or muscle spasms, twitches. And older adults really have an increased sensitivity to these medicines because as we get older, we have a decreased ability to break them down and they build up in their system. And this can lead to cognitive impairment, falls, and fractures. A lot of these medicines, if they're taken chronically, have to be tapered off. So it's really important, to meet with a healthcare professional to discuss these. And again, these are just examples of potentially inappropriate. They may be appropriate and the benefit may outweigh the risk in some of these patients. Okay. So this isn't just go to your doctor and say no. You have to have, a discussion with your healthcare provider. Another class of medicines that's potentially inappropriate is a class of medicines for diabetes, and they're called sulfonylureas. Gliberide's been on it for a while. Glimepiride was added when I was in residency. But these medicines, specifically in older adults, can cause lower blood sugars more frequently. If a patient has low blood sugars, this can lead to loss of consciousness and seizures when not treated, quickly and appropriately. A third class of medicines, specifically for hypertension, is a class of medicines called non-selective peripheral alpha-1 blockers. And these are 2 examples. But in our older population, they increase the risk of something called orthostatic hypotension. And this, in layman's terms, means your blood pressure drops upon standing. So this can increase to dizziness, lightheadedness, falls, fractures. Um, patients that are on medicines like this, on beta blockers that can, have an effect on your, pulse blood pressure. I always recommend, especially, if whether it's starting the medicine or you've been on it 10 years, when you get up, so say you're laying down in the middle of the night, okay, make sure when you wake up, you sit on the edge of your bed for a little bit, let your pulse increase, let your blood pressure increase a little bit, then stand up when you're feeling comfortable, let your body readjust before you start walking. A lot of times we see these falls and injuries happening in the middle of the night because patients on these medicines are laying down, bing, waking up, have to go pee, jolt out of their bed, and by the time their blood pressure and pulse just get out of whack and they fall, and that's how they injure themselves. And this can happen at any age. One of my best friend's moms is 60 and it just happened to her. So it really can happen, at any age. Okay. So the importance of screenings too, we want to make sure that you're getting your annual wellness visits, meeting with a provider every 12 months, especially over the age of 65. If you are over the age of 65 and on Medicare, Medicare actually covers these annual wellness visits to really help make a personalized plan, help prevent diseases and disabilities based off of your risk. The second thing, an annual physical exam. So really making sure that you're getting the labs that you need. And, assessing it if you have these medical issues, identifying them and making a plan to address them. Again, we touched on vision as an increased risk for falls. making sure you're getting those annual vision checks, making sure your dad, your grandpa, anybody is getting those annual vision checks, because this, can cause a lot of things. It can cause issues, driving. We want to make sure that we're preventing automobile accidents, but vision problems also, what I see most frequently is cause medication errors. So they think they're taking the little white pill, and nope, it was the medium white pill. And then, they take it again, and this leads to accidental overdoses. So vision checks are really, really important. Um, and then two, cardiovascular disease screenings. So making sure you're getting those blood tests for, cholesterol, lipid, triglycerides, making sure we're being proactive and that you're on therapy if needed to prevent those cardiovascular events, strokes. Next thing is depression screening. So Medicare actually does cover a depression screening once a year. Diabetes screening, so that glucose, that A1C, making sure those are within normal limits. And then, COVID-19, flu, other vaccines that are recommended by your primary care doctor. All right, so now um, I'm going to be touching on the digital medicine program. Hopefully, most of you have heard about the digital medicine program or are in the digital medicine program, referring patients to us. But this program is so beneficial and at the forefront of healthcare. I could not say enough wonderful things about Ochsner Health's digital medicine program, and that I love my job, which is amazing. A lot of people don't have the opportunity to say that they love their job, but this program I 100%, stand by, and there's data and proven results to really show the efficacy of the program, which is phenomenal. So it's a proven program to manage chronic conditions from home. So when you enroll, your primary care doctor can enroll you. Your cardiologist, endocrinologist will have a QR code at the end if you're interested in. But you get sent, whatever disease state you have. If you have high blood pressure, you're sent a blood pressure device. If you have type 2 diabetes, you're sent a glucometer. And these readings, when you take them, they go directly to your medical record. They come to your health coach, your clinician, that you're assigned a clinician, and we're able to see those, work with your healthcare team, manage your medicines, provide lifestyle support. And like I said, it's proven. It's phenomenal. The current programs that we offer, there's three. So the high blood pressure, the diabetes, and the cholesterol. Whoops. By the end, hopefully I'll be able to click through these slides. SOS. It has a lag, so I don't know if I've clicked it or not. Let me click it again. Oh my gosh, you guys, what is happening? Okay, so here is the care team. So each member works with the care team who monitors the readings, creates the personalized care plan, and to manage the condition. Again, you work with a licensed clinician. So a physician assistant, we have two on the team, or a doctorate of pharmacy, so a clinical pharmacist with residency training in patient care like myself. And then you also have a professional health coach, a pool of professional health coaches. They have a diverse background, and they're able to, provide assistance if you need recommendations on what diet is best for you, providing ideas of meal planning, setting specific goals for you, which is fantastic. And then also we have a support team. So trust me, you don't want to get your technical support from me. That is not my cup of tea, but it is the cup of tea of our patient services coordinators, and they are fantastic. If you are having any difficulty with your machinery, need assistance, you can call them. We can set a put in a ticket for them to call you, or you can even get one-on-one, in-person care through our OBAR, which there's a variety of locations. So now let me go over the clinical outcomes and studies for the digital medicine program. So 79% of members achieved their blood pressure goal after 6 months, which is astounding. Even better than that, 81% of members achieved their A1C goal after 6 months. 84% of members believing were committed to improving their health. So that's even better. And I also want to mention that not only do I love my job, but all of the members on the team really love their job. And so it makes it even that much more inspiring, and such a great program to be involved with. If you just need to call, ask a question, you're started on a new med, want help, you're started on a new med for your diabetes, or your a heart condition, but you want to know if it interacts with the medicine you're on for your diabetes, you can give us a call and we can do that for you. So you're never alone in your healthcare, which, is so great, because oftentimes it takes so long to get, an appointment these days in the healthcare system. Digital medicine, we're at the drop of a call. And then proven results. So there was a 45% reduction in ER visits among patients enrolled in the blood pressure program versus Ochsner patients not enrolled in the program. A 38% decline in hospital admissions among high blood pressure enrolled members. A 30% reduction in ER visits among type 2 diabetes members, and a 15% reduction in hospital admissions among the type 2 diabetes patients. So the member experience, 4 out of every 5 members with high blood pressure or diabetes achieved their control within 6 months. This is a nice little quote from Ms. Walker, which is a member of ours. I'm sleeping better, my skin, hair, vision has improved. I know for a fact this program has saved my life. So that is why we work. I know just within my little Teams chat with some of my coworkers, somebody posted today, a patient just called me letting them know that, I got them to control with their diabetes and their A1C is at goal. And they just called to thank her for, what she did, which you can't ask for more as a member of the healthcare team. And then what are the program perks for employees? So the program's 100% covered, which is great. For eligible employees on the OSH plus 1, 2, 3, ongoing diabetes testing supplies are provided at no cost, which is wonderful. You don't have to pay for the glucometer or the blood pressure cuff, which is great. You can earn Virgin Plus points as a pathway to wellness activity. And there's a $75 incentive for new members actively enrolled by October 1st with high blood pressure, high cholesterol, and type 2 diabetes care only. So really, really, in my opinion, you can't lose joining, but I also have bias as I'm one of the clinicians on the team. But get your parents involved, anybody. I am a huge advocate for the program, and like I said, love my job, so that's what makes things like this super easy. And yeah, so with that, I hope you guys leave today feeling a little bit brighter, and hopefully you learned something from me that you can incorporate to yourself or your loved ones to live a longer, healthier, happier life. And with that, thank you so much.
Carly, that was so amazing. Everything was so good. Please scan this QR code if you have your phone handy. It'll bring you to our Learn More sign up portal. If you have any questions, please respond to either the invite, it'll go to me, email me. We're going to send out a thank you email with the recording, so please respond to that if you have any questions. Someone did ask in the comments if they will get these slides. You will get a recording. Everyone that registered will get the recording. So use it, share it, whatever you may want to do. If you have a loved one that you think would be interested, the program is available in all 50 states. So that's amazing. We thank you so much for joining us today and spending some time with us. Carly, again, thank you. That was amazing.
You're welcome. I had so much
And
fun.
yeah, we'll be doing another one in a few months. So thank you, everyone. Let me see if there's any more last questions. They're just saying thanks. An amazing presentation. Thank you,
Awesome.
everyone.
Thank
Y'all
you,
have a
everyone.
great rest of your week.
Bye.